Hello, everyone. This is Dr. Mike Chiu, a physical therapist. Hey, today we've got a special guest. His name is Kaleb of BioTab. We'll be back in a few seconds, okay? Yes, we are back here. We're here in our Jerry High Physical Therapy Clinic. I'm here with the amazing Caleb and from BioTab Healthcare. Hey, Caleb, could you please tell us again who you are, what you do, and what are we doing here, man?
Yeah, what's up, y'all? My name is Caleb Gibson. I work with BioTab Healthcare. We are specialists in pneumatic compression. So, what pneumatic compression is and what we do is a way to treat chronic swelling from home. So, basically, what we do is we have a device that will help manage your swelling from home, and you can do it once or twice a day. And yeah, I'm here to help you all out.
Well, first of all, let's go back to the basic, what we're talking about, right? What are the common diagnoses? I mentioned there how to treat lymphedema with Caleb. What is lymphedema?
Yeah,
Mhm.
so lymphedema is another broad word for it would be chronic swelling, is what I like to call it. It could be in a lot of different ways. It can come from radiation therapy, it can come from trauma, it can come from a venous removal or a vein removal. So, lymphedema, the best way I like to explain it is you've got 400 plus lymph nodes from your head to your toe.
Can you name each one, man? Just
Not
kidding.
each, not each one. I can name the main ones that cause lymphedema,
Uh-huh.
but so the best way I can put a lymph node is whenever you get strep throat, you've got lymph nodes right here that get really
Mhm.
sore and sensitive whenever you try to swallow. So you've got two main lymph nodes that will cause this swelling. So most of my breast cancer patients will have this axillary lymph node right here in the armpit area. That will be removed more than likely from that breast cancer treatment. And then
Mhm.
you've got two in the groin area called your inguinal lymph nodes.
Mhm.
I want you to think of that inguinal lymph node like a drain in the sink. So the lymphatic system is the flow of lymph fluid throughout the lymph nodes. So I want you to think of that fluid as the water in the sink. So when your sink is working properly, you are turning the sink on, the water's flowing through the pipes like it's supposed to. But with lymphedema, when that drain is clogged, that water comes on and then everything just kind of starts pulling up. So to compare it to lymphedema, that lymph fluid is trying to flow down and it's trying to flow back up, but it can't because it's clogged right here in those inguinal lymph nodes. So naturally, gravity's going to do its thing and pull it right back down. So what I like to say is when you get a plumber to come out and fix your sink, they're not going to just shove more water down there. They're going to get some kind of pressure or compression to get whatever's clogged unclogged. So that's what our device does is it moves that fluid up and pushes it past that roadblock so it can flow naturally.
Well, I wish we got it, but we're actually trialing it now. I mean, I tried it myself today. It felt good, but I don't have lymphedema. My legs are just swollen. So aside from lymphedema, I mean, are there any other diagnoses that this device is applicable to?
Yeah, so the main one is lymphedema, but we also cover venous insufficiency.
Mm-hmm.
So that's a lack of blood flow going down to your legs that can cause swelling as well. Chronic heart failure that can cause swelling as well. So those are the three main
So
ones.
CHF diagnosis, you can still cover for that?
No, insurance only covers the venous insufficiency
Mm-hmm.
and the lymphedema, but a
Mm.
lot of my providers I work with, they know that their patient has chronic heart failure and they know that it can end up routing to lymphedema, so they go
Okay.
ahead and hit the nail on the head and get ahead of it and get the patient a pump.
Mm-hmm. So we're talking about a device here, like a machine that will push the blood flow, the swelling up. So what do they have to have a physical therapist too to prescribe this, or a physician who normally prescribe these devices?
So I work with lymphedema therapists, I work
Mm-hmm.
with physical therapists, I work with MDs, nurse practitioners.
Mm-hmm.
The main places I get referrals from would be cardiology, heart and vascular, wound care,
Mm-hmm.
depending on the state or the city, some primary cares, lymphedema therapists, or any kind of clinic that treats lymphedema, um, oncology and radiation
Mm-hmm.
therapy. Those are my main spots that see this amount of patients that
Mm-hmm.
need this help.
And then I guess my next question is when you have a diagnosis of lymphedema or swelling or whatever he's been talking about, chronic insufficiency, do they have to ask their doctor to get this device, or can they just buy this over the counter? I'm asking, as
Yeah, they can buy
general,
it over
yeah.
the counter, but
Mm-hmm.
more than likely, if you know insurance will pay for it, I would talk with your provider about it. If the provider could know about me or some of my other colleagues, but most of the time, the provider is the one that is talking to the patient about getting the equipment.
Mm-hmm.
So if you know about it and your provider doesn't know about it, that's something that you definitely should talk to them about because it is something that is really going to be game changing from you
Good, good.
at your
Yeah.
own home.
Now, for example, they received the device. How long do they have to wear this? What's the frequency, duration? It's like a medicine, I
Yeah,
mean, yeah.
I mean, like I told everybody in this clinic, I told them that everything good takes consistency.
Mm-hmm.
So we've done a lot of case studies, and from what we've seen, it's best to wear this twice a day for an hour both times. Our device will be preset for that hour, so if you are getting your treatment and you start getting a little sleepy because you're comfortable in getting a massage, you might want to take a little nap, go for it. It's not going to keep pumping you. But just to throw some positive numbers at my patients, if you're doing this for 1 month consistently, so that's twice a day for 1 hour both times, you're going to lose about 25% of your swelling.
Mm-hmm.
And in 3 months, you should lose about 50 to 54% of your swelling. And then 6 months, you'll lose about 80% of that swelling, which is a very big increase for a lot of my patients. And seeing that go down that fast is something that they didn't ever think was possible.
Mm. Mm-hmm. You know what? That's so true. Well, most of, I mean, not all, but a lot of people, they think, okay, I'll just take medication for it, I'll get a diuretic or something, or do physical therapy, elevate. But let's just say 80% of the time, it's our body still needs movement. Just like therapy, you cannot get better and stronger in your muscle if you don't physically move it. And with this lymphedema machine, this whatever you call it, BioTab
It's called pneumatic
pneumatic
compression.
device, pneumatic compression, it's manually, pushing that fluid from distal to proximal of your body, from your foot all the way up to your body, so you could redistribute and hopefully move those fluid out of your body. So it's very important that you have that physical component too, because like I said, you can take the medication, you can have someone massage it for you too, but that's very tedious, right? 2 hours a day. I mean, who can? I mean, some people can afford 2 hours of massage and pay for it, but this is a machine that insurance will cover for it, and he'll go to your home, measure you. I mean, of course, if you were here in our Jackson clinic, he's also eventually going to go to our Paris clinic location too. So again, where can they find you, Caleb? Do you have a website, telephone number,
Yeah, so
your social security, your the best
everything.
thing, right?
You need my routing and account
Yep,
number as
routing
well.
account number. So, mm-hmm.
Yeah, so you can find us at biotabhealthcare.com, but you won't be able to find me there. If you want to reach me, you can either email me at caleb.gibson@biotabhealthcare.com, and that's Caleb with a K, and that's Gibson, Gipson. And then you can either call me or fax me. My cell phone number is 901-483-7120, and my fax is 888-744-5302.
You memorized your number and fax number. All right, again, thank you very much, Caleb. Appreciate
Yeah.
you. But before I let you go, always remember the word fast, FAST, letter F. Find people that will bring out the best in you, because you are the average of the 5 people you hang out with. Today, I hang out with Caleb. I feel like I want to use, of course, we want to use this for all our patients. So letter F, find people that will bring out the best in you. Next letter is letter A, take action. All this stuff that we're doing is not going to do me good. It's not even going to do Caleb good if you don't take action. Take action. Go to their website, biotabhealthcare.com. Is that correct?
Yep.
BioTab Healthcare. Take action. If you know you got swelling on your legs, and you know it's lymphedema, that's the diagnosis, and you know it's venous insufficiency, ask, talk to your doctor, talk to your physical therapist or lymphedema therapist. Ask them, hey, would this machine benefit me? And most of the time it will work and benefit you. Okay. Next letter is letter S. Shoot for the moon. Why? If you keep shooting for the moon, you're gonna miss it. You're gonna be landing with the stars today. I shoot for the moon. I missed it. I landed with the star called Caleb. Right? Is there a star named Caleb? Right?
I don't think so.
No.
I know it's in the Bible.
Yeah. I mean, is that the guy that killed his brother, or what?
I don't believe so.
I don't believe so. Next letter is letter T. Is teach it. Why? Because when you hear it, you forget. When you see it, you remember. But when you're actually teaching it, just like what Caleb is doing, you're actually understanding it. So he's understanding, and explain to us what are the benefits of this pneumatic device for your clients and for patients and for you too. All right, be awesome. Any last parting wisdom for our people?
Yeah, just if you have chronic swelling going on and you want to treat it, you know who to call and you know who to reach out to. Reach out to your provider, and I can get in touch with your provider, and we can get this thing going.
Cool. All
Happy
right.
to help y'all.
All right. Thank you very much, Caleb. Appreciate you. We'll see you in the next episode of the Jerry Hab Show. Bye.